Hello, Assalamu alaikum. I'm Dr. Jahangir Khan and I'm going to discuss from today onward the SK10. Well, the purpose of this video is to make the better understanding of the MCQs. So if the CPSP is going to change the MCQ a little bit so that you can grab the concept. So starting from the medicine paper, that is a person wins a race competition. So there is a race, there is exertion. If there is exertion, exertion causes what? Exertion causes the activation of stretch glucose receptors. If these stretch glucose receptors are stimulated, so it does not need insulin, and the glucose enters into the skeletal muscles, and there is no need of insulin, and there is decrease in the blood glucose level. When there is decrease in the blood glucose level, the insulin goes down. If there is decrease in the blood glucose, it releases the glucagon, and the glucagon release is actually run by two things. One is the decreased glucose, and number second is the sympathetic stimulation. So over here the right option is increase in glucagon and decrease in insulin. And another MCQ related to it is the glucose enter into the exercising skeletal muscle is due to the stretch receptors. When this is stretched, so what happens? These become open. Selective beta blocker drug includes atenolol. Atenolol is the selective beta blocker, and the selective beta blocker is actually beta 1 blockers. These are the beta 1 blockers. The propranolol and the labetalol, these are the non-selective beta blocker. The labetalol is alpha selective. It selectively blocks the alpha 1 receptors, and it causes vasodilation. The beta, it is non-selective. It blocks both beta 1 and beta 2. So which drug is safe in asthma? The answer is atenolol. Beta 1 selective or safe, because in the respiratory tree we are having beta 2 receptors, and this is beta 1 blocker. So it can be used in the asthmatic patient. So coming next, regarding the beta blocker, I would add another MCQ, that beta stimulation. What is the effect of beta stimulation on insulin? These are actually my every statement is MCQ. Beta stimulation of the pancreas causes it has effect on insulin. Is it increases the insulin or decreases? The answer is increases. Is it mild increase, moderate increase, or severe increase in insulin? The answer is mild increase in insulin. The answer is mild increase in insulin. The answer is mild increase in insulin. Coming next, the beta blocker causes what? The beta blocker causes decrease in insulin. It causes decrease in insulin. But what is the net effect? Coming toward the net effect, the beta blocker causes hypoglycemia. Now there is a different mechanism for it. If the question asks the beta blocker, what is its effect on insulin secretion in the pancreas, that is decrease insulin secretion. What is the effect of beta stimulation on pancreas? That is modest increase in insulin. But if asked beta blocker causes what? Hyperglycemia or hypoglycemia? The answer is hypoglycemia. And the mechanism for this is we are having the beta 2 receptors on the liver, and when we are having beta 2 receptors on the liver, these are blocked, so there will be no gluconeogenesis and no glycogenolysis, so there will be no release of glucose, and there will be hypoglycemia. That's why we gave glucagon. The glucagon is actually the antidote for beta blocker. It causes what? It causes then glycogenolysis and gluconeogenesis, and it has effect on the heart, increases the heart rate, and reverses the beta blocker activity. The cardiac blocking activity of the beta blocker is reversed by the glucagon. So that is actually another MCQ. What is the effect of beta agonist? On serum glucose? The answer is it increases serum glucose. If it is increasing, the serum glucose. By which mechanism? The answer is sympathetic stimulation. Sympathetic stimulation. Sympathetic stimulation. Though beta agonist also increases insulin, but that is the modest increase. Modest increase. Do not confuse this modest increase with that it would cause hypoglycemia. No. So coming next, beta agonist causes hyperglycemia by increases glycogenolysis and gluconeogenesis from the liver. So I think it's clear now. If the question says, is it the propranolol that causes hypoglycemia more or atenolol that causes hypoglycemia more? The answer is propranolol, because it is non-selective beta blocker and the liver is having beta 2, that is non-selective. Coming next, silicone breast implant, that is always giant cell. After 2 years, there are signs of inflammation. There is a signs of inflammation. This is actually the giant cell. Sperm become partially motile and it is stored in the epididymis. It becomes fully motile when its pH is normalized in the female genital tract. In the female genital tract. Thirst center is stimulated by, now we have to understand this. If this is your hypothalamus, and this is your blood volume, and this is your blood volume, so what happens when there is ECF dehydration? So the osmolarity of ECF goes up. If the osmolarity of the ECF goes up, it will draw water from the hypothalamus. If it is drawing water from the hypothalamus, the osmoreceptors in the hypothalamus, they are stimulated. They are then stimulated and then they cause the thirst reflex. This is very important because the ECF dehydration gave rise to the ICF dehydration, and the thirst center is actually dehydrated. When it is dehydrated, it sends impulses. And there's another MCQ. Thirst is partially inhibited by, the answer is gastric distension. So when a person drinks water, his thirst reflex is partially inhibited. So that is actually the gastric distension. The gastric distension send reflexes back, and that inhibit the thirst reflex. So coming next, maximum stimulation of gastric secretion is by proteins, the amino acid, because they release the G cells. They stimulate the G cell and that release gastrin, and that then release the acid. Point number 1. Point number 2, they directly stimulate the acid. Thirst is stimulated by angiotensin 2. Now don't be confused by angiotensin 2 blocker. They will confuse you. The angiotensin 2 blocker decreases the thirst. It is the angiotensin 2 stimulation that increases the thirst. So the blocker and stimulation. So have an eye on the blocker and stimulation. Transport of CO2. Now, whenever there are gases, there is passive diffusion. Whenever there are gases, there is passive diffusion. Whenever there is gases, there is passive diffusion. Whenever there is glucose, mostly this is facilitated diffusion. Whenever there is amino acid, mostly this is facilitated diffusion. But local anesthetic crosses the placenta by, that is another thing. Diffusion for that is also passive for that. That is simple diffusion. Coming next, oxidases are found in, the answer is peroxisome. So what lies in the lysosome? Those are hydrolases. Do not confuse both. True about smooth muscle fiber, inner circular and outer longitudinal. So now coming toward this MCQ. Now this MCQ, the CPSP want to check your mind from where the renin is secreting. So if there is a renin secreting tumor of the juxtaglomerular cell, so what will happen? It will cause hypertension, it will cause renal failure, it will cause decreased erythropoietin. So that is the juxtaglomerular cell is the right answer. Now the heart sound produced by rapid ventricular filling is, well, there is my video on this on my channel regarding the S1, S2. So let's suppose this is your cardiac cycle. And these are the points. Now this shows isovolumetric contraction. This is isovolumetric relaxation. This is ejection phase and this is filling phase. So simple. If you remember this diagram, you will be able to pick each and every MCQ. This is isovolumetric contraction. This is isovolumetric relaxation. This is filling phase and this is ejection phase. Now coming MCQ on this. So S1 is produced during this phase, that is isovolumetric contraction. S2 is produced during this phase, that is isovolumetric relaxation. S3 is produced during early filling phase, and S4 is produced during late filling phase. This early filling phase is also known as rapid filling phase. And our scenario is this, or MCQ number 12 is this: the rapid filling phase produces which sound? That is S3. It produces S3. S1 is produced during isovolumetric contraction. Now to understand this, S1 is produced by what? By the closure of mitral and tricuspid wall. S2 is produced due to the closure of pulmonic and aortic wall. S3 is produced due to rapid filling phase. S4 is produced due to the atrial contraction against the stiff ventricle. S3 is produced due to volume overload. S4 is produced due to ischemic heart disease, ventricular hypertrophy and hypertension. Ventricular hypertrophy and hypertension. So this is the summarized form of the cardiac cycle, and you can actually memorize it if you remember this diagram. If you remember this diagram, so this is isovolumetric contraction. At the end of isovolumetric contraction, what happens? Over here, the aortic and pulmonic wall opens. Over here, the semolunar wall opens. Over here, the semolunar wall opens. And if you move toward this side, over here, the semolunar wall closing. The semolunar wall closes. The semolunar wall closes. This is isovolumetric relaxation. At the end of isovolumetric relaxation, what happens? Over here, the aortic, the mitral wall and tricuspid wall opens. And if you follow this, over here, what happens? They closes. So the portion of the cardiac cycle, coming toward that. So the portion of the cardiac cycle between the aortic and pulmonic wall opening and the aortic and pulmonic wall closure is called what? Systole. Is called what? Systole. And this is called what? Ejection phase. And this is called what? Ejection phase. The portion of cardiac cycle between the opening of the mitral wall and the closing of the mitral wall is what? Diastole. And this is called what? Feeling phase. And this is called what? Feeling phase. S1 is produced at this stage, at the start of isovolumetric contraction. S2 is produced at the start of isovolumetric relaxation. S2 is produced at the start of isovolumetric relaxation because S2 is produced due to closure of aortic and pulmonic wall, and the closes over here. So I think it will help you to memorize these MCQ for a very longer time, for a very longer duration. The atrial kink or the atrial contraction causes is 4. That causes actually is 4. There is a video of cardiac cycle 1, 2 and 3. In all of them I have discussed the relation of the cardiac cycle with the JVP, the relation of the cardiac cycle with the P waves, and all of these waves, the relation of the cardiac cycle with the ECG, the relation of the cardiac cycle with the ECG, the relation of the cardiac cycle with the pressure, what happens to the aortic pressure, what happens to the pulmonic pressure, what happens to the atrial pressure, what happens to the ventricular pressure. So you can study from there. Coming next, person had decreased motivation or emotions and talk excessively, but does not make sense. If there is no sense, there is no comprehension. There is no comprehension. And the patient is having decreased motivation and decreased emotion and talks excessively but does not make sense. So that is having no sense. So it means this is temporal lobe. So it means this is temporal lobe. So here is the reference of Mcqs aphasia. So where is the defect? This is another MCQ. There is superior temporal gyrus. In Mcqs aphasia, this is also called receptor aphasia or sensory aphasia. So the problem is where that is the superior temporal gyrus, not the inferior temporal gyrus. And this is fluent. This is type of fluent aphasia. But over here, if you see, there is a fluent speech but lacks sense. Fluent speech but lack sense. Comprehension is impaired. and there is repetition is also impaired. Reading and writing are severely impaired because there is no comprehension. Coming toward the Broca's, if you focus on the Broca's, this is motor, and this is expressive aphasia, and this is inferior frontal gyrus, and this is non-fluent. Comprehension is spared over here. Comprehension is spared over here. Over here, what is happening? Telegraphic and grammatically incorrect speech. Now, we have to understand this. If the speech is having no sense, what does it mean? The grammatically, the sentences are not. So this speech is actually not making any sense. You are having no words. What happens in the Broca's? You are having words, but that is grammatically incorrect. Like school was gone by me. He shown, yes, no, were. It is making sense, but that is grammatically incorrect. I hope I have cleared this. Coming back. So coming next, HIV confirmatory test, that is Western blot. Best initial is ELISA. Confirmatory Western blot. In adult, in kids up to 18 months, best initial and confirmatory is PCR. Why? Because the antibodies that are against HIV, they cross the placenta to the baby. The antibodies crosses the placenta and they are present in the baby. Though in the baby there is no infection, but antibodies are there. So the Western blot, there is another MCQ. The Western blot or the ELISA, if you are doing in a child, is it false positive? Is it false positive or false negative? The answer is it is false positive. False positive means the patient is having no disease, but the test is positive. So it is false positive. So what is the sensitivity? What is the sensitivity and specificity of ELISA and Western blot in children? The answer is very low. Very low. The specificity is very low. The specificity is very low. The specificity of ELISA and Western blot in kid is very low, but the sensitivity is high. You have to understand this. What does it mean? If the Western blot or ELISA is negative in a kid, it means it is high sensitive. But if it is positive, it means nothing. Conduction aphasia is due to a problem in arcuate fasciculus. Arcuate fasciculus combine if this is Broca's area and this is Wernicke's area, it combines both the areas. So if the hair is blocked, there will be conduction aphasia and there will be problem in the repetition. The person cannot repeat the sentences. Regarding pulmonic varix is the dilatation of vein. Varix is the dilatation of vein. So the vein opens into the left atrium. Very simple. 12-year boy had continuous tonic-clonic fits for the 30 minutes in a state of unconscious. So if tonic-clonic fits for 30 minutes, this is status epilepticus, and the drug of choice is lorazepam. The drug of choice is lorazepam. Coming next. Well, there are the bonus points you can memorize here as well. Which carcinoma caused by Epstein-Barr virus? So if there is a Burkitt lymphoma, pick that. Over here, nasopharyngeal carcinoma is the right. Coming next. The oropharyngeal is filled with the HPV. Fungus that invade and cause rhinosinusitis or cause thrombosis is mucormycosis. Which of the following fungus is locally malignant? The answer is again mucormycosis. It erodes the bones and moves toward the brain. It arises from the sinus or the throat or the oropharynx, and it moves upward. It involves the eyeball, and it moves upward toward the brain. And it has got association with diabetes. And it erodes all the bones, and it is actually like a cancer. And it has got poor prognosis. ABGs showed pH of 7.5. Now regarding ABGs, I have uploaded a separate video on that regarding the compensation. That is the problem. Now if you see the pH is alkalotic. The pH is alkalotic, and the CO2 is normal, but the bicarb is also alkalotic. Simple. That is uncompensated metabolic alkalosis, because the CO2 is normal, it is not moving up or down. Neurosecretory hormones are present in narrow endings. 70-year-old man develops sudden loss of power in the right upper and lower arm with deviation. Now there is a separate video on the stroke, internal capsule, cerebral cortex, and brainstem. You can find from that. Now over here, if you see, there's weakness on the right side of the body, and weakness on the right side of the face. Deviation of the angle to the left mean weakness on the right side of the face. So if mean weakness on the right side of the face, it means the right facial nerve is involved. And weakness on the rest of the body, so it means it is uncrossed. The crossing and the uncrossing is not according to the angle deviation, it is according to the facial nerve palsy. If the angle is deviated toward the left, the right facial nerve is paralyzed. So if the right facial nerve is paralyzed and the right side of the body is paralyzed, then this is uncrossed. So over here, the answer is internal capsule. If it was crossed, then the answer would be pons. The answer would be pons. So over here I would give another thing. If there is midbrain, pons, and medulla, the third and fourth arise from the midbrain. The next four arise from pons. 3, 4, 5, 6, 7, 8. The 9, 10, 11, 12. The next four arise from medulla, because there are separate MCQs. Which nerve arises from the back? That is fourth nerve. Which nerve arises from the back and decussate? Against the fourth nerve. Next, sarcoidosis is diagnosed microscopically by. What is the difference between microscopically and histologically? In histologically, you give the stain. In microscopically, you may or may not give the stain. So over here the answer is B. That is non-caseating granuloma. Yes, non-caseating granuloma. But if about histologically, then caseating granuloma. You need stain. Most resistant organ to transplant rejection is liver. Why? Because it produces inhibitor substances, and that actually inhibit that reaction. Anemia type in chronic renal failure is normocytic normochromic. And there is another MCQ on that. A patient with CKD, you have to give what? Erythropoietin plus iron both. There is another MCQ. A patient with CKD, you give only erythropoietin. Now, which type of anemia you would expect? The answer is iron deficiency anemia, microcytic hypochromic anemia, because the erythropoietin has actually corrected the anemia of chronic disease. It causes increased replication, but for increased replication you need iron. If you do not replace the iron, it leads to iron deficiency anemia, and then it would be microcytic hypochromic anemia. You have to keep this thing in mind. Next, transfusion reaction will occur if A positive blood is transfused by. Now I would give you a concept over here. If the question is if transfused to. Now most of the time we do not focus on this and pick. We have programmed our mind with the option during our preparation, so we directly pick the option we have already programmed mind with. So what you have to do, you have to focus on to and by. Over here, transfusion reaction will occur if A positive is transfused by, means अगर A को कौन सा blood transfuse करो, and you have to look if there is two, then the meaning is totally different. If A positive is transfused to, A को किसके साथ transfuse करे, A को कौन सा blood transfuse करे और A किसको transfuse करे. There is a difference between the two. So here the right option is if A is the recipient. So out of these, which will cause transfusion reaction? The A has got B antibodies. So if you are introducing the B antigen, there will be reaction. So answer is B. Thyroglobulin is synthesized by follicular cells. Now the ischia pink, there was thyroid hormone. So that was actually, this is the correct MCQ is thyroglobulin actually. Anterior inferior cerebellar artery is a branch of Basilar artery. There is a branch of basilar artery. Cerebral metabolic rate of oxygen consumption is, that is 20% of total consumption of oxygen at rest. 20% of total consumption of oxygen at rest. Over here I will give another MCQ. Which organ has least oxygen consumption? The answer is dorsum of the hand. If there is decreased oxygen consumption, so there is another MCQ. Which organ is having no oxygen gradient? Oxygen gradient means if this is the artery and this is the vein, so the tissue take oxygen. So in artery the oxygen is high, in vein the oxygen is low, so there is a gradient. But if there is no oxygen diffusion and the concentration of oxygen becomes in artery is equal to the concentration of oxygen in vein, so there is no oxygen gradient, again the dorsum of the hand. In which of the following organ there is no capillary bed? Again the dorsum of the hand. Again the dorsum of the hand. So don't be confused and open your mind. Which of the following is having increased oxygen extraction? The answer is heart. Which of the following is having high oxygen gradient? The answer is heart. Because if it is the artery to the heart and this is the vein from the heart, it takes a lot of oxygen from it. So there is high oxygen, there is low oxygen. So the difference in oxygen is highest in the heart. So the difference in the oxygen is highest in the. Regarding other MCQ that are coming in the next section, we will focus on that. Coming next, the most common site of fracture of the clavicle is, the answer is right, that is the junction of the medial 2/3 and the lateral 1/3. Drug used for hyperthyroidism in 20-week of pregnancy is methimazole, not propylthiouracil. Why? Because it causes fulminant hepatic failure, fulminant hepatitis. In the first trimester, you are using propylthiouracil. Why? Because the methimazole is teratogenic. Methimazole is teratogenic. Burkitt lymphoma oncogenes by Epstein-Barr, that proto-oncogene CMYC transcription. Conus medullaris ends at conus medullaris at the lower end of spinal cord, and the spinal cord in the ends at the L1. Blood supply to the middle of esophagus is descending thoracic aorta. If this is the esophagus, it has got upper end, middle end, and lower end. It has got upper portion, middle, and lower. The upper portion is supplied by inferior thyroid artery. The middle is supplied by thoracic aorta. The lower is supplied by the left gastric artery. Very simple. Blood supply of apex of the heart is, the answer is marginal artery, but they can confuse you. Blood supply of the interior wall of the heart with the apex of the heart, then the answer is LAD. Don't be confused. Then the answer is LAD. Marginal only apex, marginal artery. What is the second name of the marginal artery? Acute obtuse artery. Acute artery. If the angle is less than 90, you remember from the maths, this is acute artery. Blood supply with the apex of the heart, the answer is marginal artery. If that is not, then the answer is acute artery. Obtuse artery is on the other side. That is not important. Over here, apex along with the interior wall of the left ventricle, the answer is LAD. If the question says interior wall of a heart is supplied by, the answer is RCA. Over here they are asking about the interior wall of the heart, not the interior wall of the left ventricle. That is another thing. The interior surface of the heart is made by the right ventricle, and the right ventricle is supplied by the RCA. If the question says interior wall of the left ventricle, then yes, you have to choose the left coronary artery. You have to choose the left coronary artery. There's another MCQ regarding the codominancy and the right dominance, and I think we will discuss in the future that. Which among the following nerves is damaged in a patient with ptosis, mydriasis, and diplopia? If there is only ptosis, the answer is myasthenia gravis. If there is ptosis with constricted pupil, the answer is with constricted pupil. The answer is Horner syndrome. If there is ptosis with dilated pupil, the answer is third nerve palsy. The answer over here is oculomotor nerve. Thiazide diuretic, it causes what? Hypokalemia. It causes what? Hypokalemia. The loop diuretics usually does not cause hypokalemia. Why? Because if it is your nephron, what happens? The loop diuretic, they block this thing. So the loop diuretic does not cause hyponatremia. Yes, the loop diuretic and thiazide diuretic, they causes Both causes hypokalemia, but the loop diuretic does not cause what? It does not cause hyponatremia. Sorry, that hyponatremia. How? Because if there is sodium coming, what happens? The sodium is absorbed over here and potassium is released. So the sodium is maintained. That is aldosterone. Aldosterone goes up. Aldosterone goes up. Aldosterone goes up. So thiazide diuretic and loop diuretic both causes hypokalemia. That is point number 1. Point number 2, the loop diuretic does not cause hyponatremia. Why? This is the reason. Because if there is sodium coming, there is increase in aldosterone. The increase in aldosterone causes what? It causes absorption of sodium and release of potassium. So the sodium is maintained. So that's why you have to give in combination the loop diuretic plus aldosterone antagonist, because all the effect of the loop diuretic is cancelled over here. Coming next, richest source of vitamin K is green vegetables. That's why when a person is on warfarin, we ask the patient, do not take the green vegetables. Why? The green vegetable has vitamin K, and vitamin K it actually antagonizes the effect of warfarin, and there is no effect of warfarin, the INR goes down. If the INR goes down, there is treatment failure. Chromosome with 2 parallel chromatids, prophase. What is the landmark of pudendal neuroblock? The answer is ischial spine. Chorea due to the defect in caudate nucleus. Caudate. Genotype of an individual is XYY. Now, if you see, true hermaphrodite is also having XXY. But for true hermaphrodite, the most common is XX. If that is not, then XX, XY. If that is not, then XXY. So that is very rare. But for Klinefelter, this is the most common. And XYY, what is this? This is Jacob syndrome. And for Turner, that is 45X0. Hydrocephalus most commonly caused stenosis by duct of Salvius. And hydrocephalus causes what? Motor deficit. Remember this. Hydrocephalus causes what? Motor deficit. Autoregulation of renal blood flow maintains arterial pressure at 80 to 120. Normal pressure, because it will maintain the pressure at normal pressure, and the normal pressure is 120 to 80. Simple. Male with gynecomastia, loss of libido, and incapable of erection of penis. The answer is simple. Decrease in gene RH, so that will lead to decrease in FSH, decrease in LH, decrease testosterone. Coming next, microscopic section of the gland shows mucinous acini capped by serous demulins, a number of interlobular ducts. Now you have to focus on this. The parotid gland is the serous gland. The sublingual gland is the mucinous gland. Submandibular gland is both. Now focus on this. In the MCQ, they are mentioning the serous acini and the mucinous acini. Simple. Lady has menstrual cycle of 28 days. So if in order to find out at which day ovulation will occur, you take the days of duration and subtract 14. So that is 14. So if they gave you a cycle of 40, so 40 minus 12, 40 minus 14, what is the answer? So that is 30, 26. Ovulation will occur at 26. Which phase of the menstrual cycle is constant? So that is secretory phase. The secretory phase is constant. This is follicular phase. This changes. Administration of glucocorticoids is decreased in peripheral glucose uptake into the cell. You have to focus on this. It causes what? If this is the cell, it causes decrease uptake of glucose, and this is the reason that causes hyperglycemia. Hyperplasia of lymphoid tissue is a prominent feature of leishmaniasis. Oh, sorry, one MCQ is left 65. Carbidopa is given with levodopa, and which enzyme it is dopa decarboxylase. It is dopa decarboxylase, because if you give only levodopa, and this is your brain, before growing toward the brain, like in GI, in blood, in liver, the dopa decarboxylase destroys it. So if there are 100 molecules, only one molecule reaches to the brain. But if you block the peripheral conversion of the levodopa, what happens? the blocking of the decarboxylase. So there will be maximum bioavailability of the levodopa. Hyperplasia of the leishmaniasis, that's why it presents with the hepatosplenomegaly and lymphadenopathy. Internal jugular vein after leaving jugular foramen has immediate relation with internal carotid artery. Which are the following type of drug with have maximum oral bioavailability? Large hydrophobic yet soluble in aqueous solution. So that this has maximum bioavailability. Lipoprotein rich in cholesterol is LDL. That is why it's called bad cholesterol. So for today this is enough. This is SK Gynae 10 and we are discussing it with the concept. Thank you for watching.